Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. On the show today, we have special focus on COVID in kids and pregnant women. Now, we all know that obviously both these sections are more vulnerable, but remember that not all get a severe form of the disease if timely intervention is made. So if you are a mother or a mother-to-be, what are the things that you can keep in mind and things that should immediately call off the red flags for emergency? Here's an explainer. Now, compared to the first wave, the second wave has seen many more kids contract the virus. However, no study at this point suggests that kids are more vulnerable in any way to the new mutants. Experts believe that the onset of the second wave actually coincided with, unfortunately, opening up of schools and unlocking of curbs, thus infecting India's children more. But important thing to remember is that kids in most cases will only get a mild illness and show good recovery with proper management. It's mostly babies under the age of 1 who might be at a higher risk of severe illnesses with COVID-19. That's compared to the older kids, and they should be kept under watch. So what are the signs and symptoms that you must watch out for in kids? Well, fever above 100, abdominal pain, diarrhea, skin rashes, headache. Children might also experience being weak, dizzy, dehydrated. Now, acute infection so those what I just highlighted for you are the mild symptoms, but there can also be acute infections, and those in children are generally of two kinds. Number one, a child may get pneumonia, and there are enough signs for that. And there could also be what is now more and more being reported as an antibody-mediated inflammation called a multi-system inflammatory syndrome in children, commonly known as the MISC. Now, this could be serious. So if you notice the following things that I'm going to tell you, you need to get help quickly. Emergency warnings to watch out for in this case is severe stomachache, difficulty in breathing, pale grey or blue colored skin, lips and nail beds also changing color. If your child is of late sounding a little confused, not knowing what to do, and inability to wake up or stay awake. Watch out for these symptoms. That definitely means that you need to contact your doctor immediately. Let's move on to pregnant women now. When it comes to them, the good news is that compared to non-pregnant women, you are only 0.28 times less likely to have symptoms. Now, study on pregnant women in Maharashtra actually found out that 8 out of 9 pregnant women are actually asymptomatic. However, experts say that pregnancy is to some extent an immunocompromise. So yes, pregnant women are at a higher risk of infection. In fact, women in their 3rd trimester are said to be more vulnerable than the earlier stages of pregnancy. Now, these women in severe cases are more likely to develop a respiratory complication as well. So their breathing has to be monitored very closely. Now, all mothers are constantly thinking when it comes to pregnancy that what if I get it? Will I pass it on to my child? Well, the answer to that is both no and yes. Let me explain. Now, what passes on from a mother to child inside the body to the fetus mostly are antibodies. But that does not mean that some kids cannot contract the virus after birth, because they could get it actually through contact. Mothers, that is the reason why with symptoms of COVID are advised to wear a medical mask during contact with their baby as well. So at the moment, stay calm, try to stay positive and consult your doctor on any specifics. And on that specifics, let's get our guests also. We've got Dr. Mahesh Katre joining us. Very delighted to have you join us from United Kingdom. We've got Dr. Anupam Sibbal with us. He is a pediatric gastro person joining us from Apollo Group of Hospitals. And also Dr. Nikhil Datar will be with us shortly. He's a gynecologist at Cloud9 Hospital in Mumbai. Dr. Mahesh, let me begin by asking you the most common question, something that is really disturbing a lot of people at this point. When it comes to kids, and if you look at the categories 0 to 5, 5 to 10, 10 to 15, in this category of people, who do you think is most vulnerable and what are the precautions they need to take? Dr. Mahesh, please.
Yeah, thank you, Sonal, for having me in your show. I mean, as you explained very nicely in your first explainer video about the risk in children and what symptoms to watch out for. What we have noticed here, especially in England, is in between 10 to 15 years of age group, especially the teenagers, they are coming in with, as you rightly mentioned, multi-system inflammatory syndrome, what we call here as pediatric multi-system inflammatory syndrome, temporarily associated with COVID. So that's nomenclature as well. So these are the children we are kind of commonly seen. Now, having said that, most of them, they are recovering very well. Even though they get admitted into the intensive care unit or pediatric wards, we have seen the good recovery rate into that.
And the treatment is the same as it is for adults?
So yes, so for treatment, so that's the different bit part. What we are doing here, we are conducting a trial called recovery trial. So every child who comes in, we randomize them to different treatments. So most of the time we're using is basically the steroids called dexamethasone. That's kind of our main line. Sometimes we use immunoglobulins as well. Remdesivir, we are not using that commonly. And for that to use, we are using we are speaking to a lot of different experts as well. So that's not our common go-to drug. Other thing we have noticed is they're coming with low blood pressure. So then we have to give called peripheral adrenaline and then involve the cardiologist as well. But again, having said that, the recovery in them is very good. Right.
Dr. Anupam, let me bring you in, and in fact, let me take some of the questions now coming in as well as we wait for our third guest to join us as well. With kids, Doc, it's difficult to sort of pinpoint on symptoms. Adults can communicate, they can tell you very clearly what they're feeling, how they're feeling, they're more aware. Some tips if you could share with our viewers on what are the signs one can watch out for. That's why I mentioned confusion as actually a symptom, because a lot of time kids don't know how to explain what's happening to them.
Sonal, it's a pleasure to be on your show. So let's kind of demystify this a bit. Yes, of course, young kids, less than 2, 3 are unable to point out. And therefore, the mother or the caregiver has to be a little cautious to pick up signs. So what are the common things that we see? Fever, common. Cough and cold we were seeing earlier on in the first wave. Now we are seeing diarrhea and in older children pointing towards the tummy or, suggestive of basically having tummy ache. You can sometimes just have a kid who's just not wanting to eat, is feeling really limp and lazy and lethargic. But typically what happens is that most of these symptoms will get missed unless, of course, there's a family history of contact. So the first thing that I want to clarify here, and I don't want parents to be alarmed here, that listen, if the child's got manifestations, they will become evident to you in a day or so. But typically this happens in a setting where someone in the family is positive. It's a parent who's positive or a nanny or a grandparent, and that's when you start thinking about COVID. The second thing I want to mention here is that the vast majority of kids who develop COVID-19 will do very well. They will have a few symptoms, if any at all, for a few days, and then they'll bounce back to being their normal chirpy selves.
Okay.
The syndrome that has just been described in the UK, we're seeing that more in the Western population. So I don't want people to start Googling MISC, start looking at steroids and aspirin and so on and so forth, Kawasaki disease-like illness. Remember that the vast majority will have an uneventful course. And if they have some symptoms, they'll be pretty mild, so don't get alarmed. But a couple of words of caution, children are not miniature adults. So please don't look at the adult fancy prescriptions that are floating around and that one sees every day and say, oh, I'll give half the dose of this or 1/3 of the dose of this because I'm looking after a child. Listen, children don't need any of that medication. Paracetamol for fever, vitamin C can do no harm, zinc can do no harm, and that's about where it stops. Beyond that, the pediatrician has to decide, looking at a variety of factors, on what medication, if at all, and for how many days. Similarly, a word of caution, please don't rush into getting a CT scan. You don't want to expose your child.
We can't emphasize enough. We've been talking about this in show after show, really. Right.
Yeah, radiation. You do not want your child to be exposed to radiation. What for? What are we looking for? Is it going to change management? Don't rush around getting D-dimers and LDH and all the other tests that are done in adults. Please
Okay,
discuss
very
it.
quickly answer this then. If you see any of the symptoms that we've just talked about and you've spoken about, what is the first response a parent should be taking?
The first response is make the child comfortable, give paracetamol, make sure that the hydration is fine, give fluids, give only food that the child's interested in, pick up the phone, talk to your pediatrician, do a WhatsApp call, let the pediatrician make an assessment and then decide. Investigations, yes, no. Chest x-ray, yes, no. CT, yes, no. Hospitalization, yes, no. And please don't start measuring saturations every 2 hours. Don't need that. 3 to 4 times a day is fine. And just because the saturation has gone from 96 to 95, oh my God, no, relax. It's okay. We want to see a trend. It's from 96 to 95 to 92 to 90, 87. Yes, it's going down. A one-off, 1 or 2 here or there, doesn't matter. So I think I want to use the medium of your program to reassure people. People are panicking out there. They're just Googling stuff and then they just look at the worst case scenario.
Well, don't Google. Just note down everything that Dr. Sibal has just said and follow that protocol. He's just given you a good step-by-step guideline on what to do and just follow that. Let me take in a quick viewer question which is regarding kids, and then I can move in to bring in Dr. Datar as well and we talk about mothers then. There is a quick question there, Doc, by Rohit, who writes to us saying what drugs to give to pediatric population infected with COVID, especially those below 5 years, symptomatic treatment or antivirals can be given or not, he asks, in case of positive parents. I think that's where the question really lies. And negative result for baby, what is advised?
Okay, so Rohit, this is an important question. If a parent is positive, what do you do? Okay, the first thing is you wear a mask. Your partner wears a mask because you want to protect the child if the child hasn't been infected. It's extremely hard for a child to wear a mask at all times. The older kids, you can try, young ones, not possible. Give paracetamol if the child gets fever, give vitamin C, give zinc, and that's where it stops. Please, let's sort of not worry too much about antivirals. What antiviral are we talking about? Remdesivir has to be given IV. What are the indications? Extremely limited. What does it do? It shortens the stay in hospital. That's about it. Yes, it can be used.
It's no lifesaver drug. It's no magic drug.
It needs to be used judiciously. Other stuff, steroids, yes, can be used, but again, limited indications. Oxygen, yes. So I think what you need to do is please, there's no such thing as precautionary medicine. There is no such thing as prophylactic. If there was a prophylactic pill, would we be in the state we are in?
Right, and there is also no such thing as just holding oxygen concentrators at home and thinking it is some sort of security blanket, because it is not. Let's just get that clear as well. Let me bring in some question for mothers now, and lots of them that have been thrown at us. Dr. Nikhil Datar is also with us now. Dr. Datar, you are somebody who actually were telling me some time back that you have at least about 11 COVID positive mothers or mothers to be at this time that you're looking after, and lots of questions now specifically about the treatment when it comes to mothers to be, because there is so limited medicine that they can actually take. How exactly is the treatment process like?
First of all, thank you for the invitation. Before I proceed, if I can just request you guys to just put me back on Skype call and video call, because I've sorted some technical glitch so that I can take the next questions on video. Now, coming back to your questions, to begin with, first of all, I want to reassure all the mothers there, in particular who are pregnant women, that pregnancy does not predispose them excessively to COVID infections. As a matter of fact, young and women, both are actually protective in that sense. They are to some extent little immunocompromised, so they might get infected, but there is no data which says that a pregnant woman gets more serious or something of that sort, there is an effect on the baby or something of that sort. Of course, a mother who gets serious, if at all, the chance is very less, but if at all she gets serious, then she will have, and doctors will have, little more trouble while we are treating, particularly if she is in the second half of the pregnancy, because uterus is growing, it's already putting pressure onto her lungs, etc., etc. But by far and large, we have seen that so much of steroid secretion and hormone secretion naturally happening in her body actually works as a protection against the disease getting severe in a case of a pregnant woman. So women should feel very reassured after hearing this particular
good news of the day, really. That's the good news of the day. So calm down, mothers to be over there. Let me quickly take in a Twitter question that we've got from a viewer. It's from me Mumbaikar42. It says, hi, my sister is 6 months pregnant and lives in Lucknow. Currently, Lucknow is in the worst affected district of UP. I want to know what precautions and measures she can take and that she can follow with other kids as well. And at what point does she need to go to the hospital?
Well, I mean, precautions for COVID remain the same. I mean, it is going to be 6 feet distance, social distancing, masking, frequent hand sanitization, etc.
Right.
It's always a good idea to develop and build good amount of immunity. So few immunoboosters like vitamin C, zinc, etc., no harm. Some respiratory exercises, absolutely no harm. General exercises, absolutely no harm. Of course, getting out in open might not, particularly in public place, might not be a good idea because you might end up getting infected, getting exposed to this kind of a virus from somebody else. But having said that, standard healthy living style is definitely a welcome kind of a thing. Second important thing, we have always seen, whether in pregnancy or otherwise, women who are hypertensive, who are diabetics during pregnancy, again are more likely to develop these kinds of infections. And we are seeing more particularly in our metro cities that incidence of hypertension in pregnancy, incidence of diabetes in pregnancy, and incidence of obesity in pregnancy is much higher than what it used to be. So if at all women take specific care during pregnancy about these things in general as well as in particular in relation to COVID, then I think they will not have to worry so much.
Right. Actually, my heart goes out to all those who are pregnant right now. Anyways, it's such an anxious time in your life, and then add to that all the COVID negativity all around. On that note, let's quickly take a break. When we come back, some more viewer questions. We'll have our experts answer them. Welcome back. You're watching FYI, where we're discussing COVID, its recovery process, its treatment process in kids and in mothers-to-be. Lots of questions coming in from mothers there. Let me take the next question to Dr. Nikhil Datar as well. Dr. Datar, a lot of questions really are on passing on COVID to your child. So if you could break it down for us, what happens if in different stages of pregnancy, for example, if the mother has contracted COVID towards the end of her pregnancy, what happens to the child? Will he be born with antibodies?
Okay. So, quick answers to questions. First and foremost, there is no direct mechanism of mother passing the virus to the baby when the baby is in her womb. So that's again something which people should be very clear about. That automatically mother is infected, so it doesn't mean that automatically the virus will go to the baby. So we call it as no known data available on transplacental transfer of virus.
Okay.
So baby doesn't come out with an infection. But as we all know that it's a respiratory virus, and post-delivery, when the mother is breastfeeding the baby, like any other person getting infected, there is a possibility that the baby will also get infected. So it does pose a lot of challenge to a nursing mother or a breastfeeding mother, because on one hand she has to take the baby close to her chest and breastfeed. Breastfeed is the best feed, so that's why on one hand she should breastfeed the baby, but on the other hand, how does she prevent that kind of a close contact and respiratory exchange of gases, and how can she prevent possibility of virus getting passed on to the baby? So then that point of time it becomes a technical challenge, because in most of these hospitals we have a problem that they are isolated, there are no attendants, babies are supposed to be kept at least at about 6 feet distance. So mother has to kind of take the baby. She may pass on the virus while touching the baby or through the respiratory system and all that. So again, hygienic precautions, having a good mask at that point of time, hand sanitization, probably wearing gloves at the time of handling of the baby, and minimally handling the baby. That's breastfeed and keep the baby away. Okay, and rest of the things, that is changing the nappies, etc., probably can be entrusted upon somebody else. Might turn out to be a better idea to manage.
All right.
Now,
so can breastfeed, you are saying, there is no evidence at this point that it will be transferred to the baby, at least not yet, that we know of.
Not at all.
And after delivery, after the birth of the child, basically, it could be transferred to the baby, but only through contact. Is that correct?
Absolutely. Perfect.
Okay. Okay. Also, another last question, really, Dr. Datar, I just wanted to get your quick thoughts on pregnant women trying to think about vaccine right now. We know that officially we don't have any data saying that they should keep away, but some things that they should keep in mind, especially if they are on meds.
So there is, obviously, this whole thing is new and science is new, but evidence more particularly related to pregnancy is always going to lag behind because we have to have sufficient amount of data to officially declare it to be safe.
Right.
Theoretically, it may be safe. But at this point of time, the guidelines do not allow vaccination to pregnant women at this point of time, at least in our country. But I am aware of the fact that Pfizer and the Moderna vaccine is being given to pregnant women abroad, more particularly after taking the consent that there is insufficient data available. But I suppose for our country, honestly, we don't have any experience of giving vaccines to pregnant women here in our country because we follow these guidelines. So we are not aware of such kind of a thing. But logically, should be safe to be given.
All right, leave it there for the moment. Thank you all, doctors, for joining us and giving us your such valuable feedback. We really hope this was helpful for our viewers as well. Keep writing into us. If there is a particular issue you want us to raise on the platform, do write into us on various platforms. Bye for now.